In the U.S., the number of moms who die during childbirth is among the highest of any developed nation in recent decades. The rate is even higher for Black women. That's according to the U.S. Department of Health and Human Services. The White House announced that North Carolina is getting more than $4 million in federal funding to help turn these trends around. WCNC Charlotte's Jessie Pierre in East Charlotte today and shares more about the disparities Black women face during childbirth.
I spoke to a mom who says as a Black woman, she went into the delivery room feeling more afraid than joyous. Her experience is not uncommon for Black women in this country.
Having to have the thought of there's a possibility that I might not come out of this hospital, that was really scary. I remember telling my husband, take care of her. If something happens to me, take care of her.
Jessica Rushing is a mother of 3. She says what should have been a beautiful experience giving birth to her first child was overshadowed by fear.
I didn't love the birthing experience. I had a vision of how I wanted it, and I feel as soon as I got in there, my voice stopped being heard.
Not having a voice in the delivery room is something Iman Boykin, a doula, says she hears way too often, especially from women of color.
I've worked with so many women and I've talked to so many women that talk about the trauma and the pain that they deal with when it comes to birth.
Women are dying during childbirth in the U.S. at higher rates than in other developed countries. In North Carolina, Black women are more than 2 times more likely to die from pregnancy-related causes compared to white women.
Women, when they're giving birth or after giving birth in the postpartum period, they can say that something does not feel right and they're not listened to.
I think there are lots of stereotypes that go into just being a Black woman having a child, or just being a Black person and pain. You have a higher pain tolerance. You can, you don't know what you need. We're the professional.
North Carolina is receiving more than $4 million in federal funding to improve and increase access to maternal health care and to reduce the number of deaths during childbirth. The investment will also go to address the maternal mortality crisis and ongoing disparities, especially in underserved communities.
It's a trickle-down effect from making sure we're educating the people correctly. Are we going into the universities, going into the schools that are preparing the nurses, the midwives, the doctors, making sure they understand and we're breaking down those racial disparities from there.
Both women say it is about protecting moms during childbirth and making sure they're able to deliver safely and have healthy babies. Both say they want to see the investment grow and want moms to know their voices matter. In East Charlotte, Jessie Pierre, WCNC Charlotte.